Hi, my name is Kara Rotatori. I'm a pharmacy student at UConn, and today I will be presenting on the impact of emergency situations on pediatric antibiotic stewardship and roles pharmacists can undertake. According to the 2019 CDC Antibiotic Threat Report, 2.8 million antibiotic-resistant infections in the United States led to over 35,000 deaths. Pediatric antimicrobial stewardship programs, abbreviated pediatric ASP, lower antibiotic resistance, help prevent disease, promote health, and prolong life. During public health emergencies, pharmacists can use pediatric antimicrobial stewardship skill sets in specific situations to improve patient outcomes. Pediatric patients are not just tiny adults. Adults in pediatric diseases or clinical presentations often vary. For example, children with H1N1 were at higher risk for severe disease compared to adults. Additionally, evaluation of infections in children should include assessment of vaccinations. Pharmacokinetic properties are also very different compared to healthy adults and vary based on a child's weight and age. Volume of distribution is often higher in neonates and infants. Older infants, children, and adolescents have higher clearances than adults. Furthermore, community-acquired pneumonia and meningitis are known to be caused by different organisms based on age. In the middle of my poster, you will see arrows, each of which describe key interventions that pharmacists can participate in to improve antibiotic use in pediatric patients. Let's start with prospective audit with feedback. Pharmacists and pediatric ASPs can identify patients with critical infection and determine if the patient is receiving appropriate therapies. Pharmacists should explore different dosing frequencies and processes, considering pediatric pharmacokinetics to decrease nursing time and/or exposure, depending on the emergency. Another intervention for pediatric ASPs is pre-prescription authorization. Pharmacists can monitor key antimicrobial drug shortages and educate providers on responsibilities associated with specific medications in order to ensure that patients receive the correct medications using evidence-based practice. Another intervention includes streamlining and de-escalating therapy. Pharmacists and pediatric ASPs can help create protocols for patients receiving treatments for emergencies based on clinical condition and lab results, thus reducing inappropriate antibiotic use. Another intervention includes education. Pharmacists can educate providers on local treatment guidelines and potential medication toxicities. In times of information overload, antimicrobial stewardship programs can interpret data for frontline providers. Dosing optimization is another important intervention for pediatric ASPs, where pharmacists can identify optimal medication dosing and dosage forms for pediatric patients. Finally, pharmacists and pediatric ASPs can create local treatment emergency guidelines and adapt existing guidelines for the present situation. This includes finding solutions to potential drug-drug interaction issues that may arise. During the COVID-19 pandemic, pediatric ASPs have had the opportunity to implement these interventions. Studies suggest that COVID-19's acute disease manifestations are less severe in children than in adults. SARS-CoV-2 has been associated with multisystem inflammatory syndrome, or MIS-C, in children, which can be life-threatening. Little data supports the use of remdesivir for COVID-19 in children. As antimicrobial medication experts, pediatric ASPs are able to explain key information on dosage forms, regulatory information, and other important factors to frontline providers. Specific pediatric dosing for emerging therapies for acute COVID or MIS-C, such as remdesivir, steroids, IVIG, and anakinra, needed to be determined. Pediatric ASPs help in providing current data to guide recommendations to frontline providers. Thank you for listening to my poster presentation. If you have any questions, please use the Google form and I will get back to you. I would love to connect with you on LinkedIn, and you can find a link to my page at the top of my poster. Thank you.